Welcome to today's discussion on Triamterene stones, a less common but important type of kidney stone. We'll explore what these stones are, how they form, and what can be done about them. Join us as we delve into the world of urological health and shed light on this specific condition. Triamterene stones, as the name suggests, are primarily caused by the medication Triamterene. This drug is a potassium-sparing diuretic often prescribed to treat high blood pressure or edema, which is fluid retention. However, in some individuals, Triamterene can crystallize and form stones in the urinary tract. Risk factors include high doses of the medication dehydration and individual variations in how the body metabolizes the drug. The pathophysiology of Triamterene stone formation is fairly straightforward. After ingestion, Triamterene is metabolized in the liver. Some of the unchanged Triamterene and its metabolites are then excreted by the kidneys. If the concentration of these substances in the urine becomes too high, particularly in the presence of dehydration or acidic urine, they can precipitate out of solution and form crystals. These crystals then aggregate over time, potentially forming larger stones that can obstruct the urinary tract. Triamterene stones are not as prevalent as other types of kidney stones, like calcium oxalate stones. The exact epidemiology is difficult to determine, as Triamterene use varies across different populations and clinical settings. However, it is estimated that Triamterene is responsible for a small percentage of all kidney stone cases. The incidence is higher in individuals taking Triamterene for extended periods or at higher doses. The signs and symptoms of Triamterene stones are similar to those of other kidney stones. These can include severe pain in the side or back, often radiating to the groin or lower abdomen. This pain, known as renal colic, can come in waves. Other symptoms may include blood in the urine, nausea, vomiting, frequent urination, painful urination, and if an infection develops, fever and chills. Diagnosing Triamterene stones typically involves a combination of medical history, physical examination, and imaging studies. Your doctor will ask about your medications, including Triamterene. A urine analysis can detect the presence of blood and crystals. Imaging techniques such as a CT scan or ultrasound are often used to visualize the stones in the kidneys or urinary tract. Sometimes, the specific composition of a past stone is analyzed to confirm it contains Triamterene. While Triamterene stones are primarily defined by their composition, they can vary in size and location within the urinary tract. They can be found in the kidneys, ureters, or bladder. The size and location will often influence the treatment approach. Treatment for Triamterene stones depends on the size, location, and symptoms. Small stones may pass on their own with increased fluid intake and pain management. Medications such as alpha blockers can help relax the ureter and facilitate stone passage. Larger stones that cause significant obstruction or pain may require more invasive interventions, such as extracorporeal shock wave lithotripsy, ureteroscopy, or percutaneous nephrolithotomy. If a patient is actively taking Triamterene, the physician will evaluate if the medication can be changed to something different. Preventing Triamterene stones primarily involves addressing the underlying risk factors. Adequate hydration is crucial, aiming for a urine output of at least 2 liters per day. If Triamterene is necessary, using the lowest effective dose may help. In some cases, medications to alkalinize the urine may be considered, as Triamterene is less soluble in alkaline conditions. Regular monitoring of urine pH and stone formation is also recommended for individuals at high risk. The prognosis for individuals with Triamterene stones is generally good, especially with appropriate treatment and preventive measures. Recurrence is possible if the underlying risk factors are not addressed. Recent research focuses on developing more effective methods for stone dissolution and prevention, including exploring novel drug therapies and dietary interventions. Understanding individual metabolic profiles may also lead to more personalized approaches to stone management. Stay informed and work closely with your healthcare provider to maintain optimal urological health.